This is the slide of, yes, human umbilical cord. This is one slide which you will never go wrong. Only if you identify this under scanning objective. Most of the colleges usually focus this under the dissection microscope. There are only two slides that can be focused under dissection microscope in your entire histology. One is umbilical cord and the other one is spinal cord. How do you identify this as umbilical cord? This typically has the appearance of face with two eyes and one big mouth, right? So this is the slide of umbilical cord. Even if you get this for discussion, this is the reason why I said every time you get a slide, try to hold it against light and see it once, right? If you get the slide of umbilical cord and if you keep focusing under 10x magnification, you will possibly never identify it. That is why always make it a habit to see it from the outside first and then focus it under microscope. If your college uses the dissection microscope, please specifically ask for it, or if your microscope has a scanning objective like this of 2x or 4x, then focus it under 4x or 2x objective, right? Right. So this is regarding the umbilical cord identification. How do we describe the structure of umbilical cord? When we take the transverse section of the umbilical cord, the outermost covering of the umbilical cord is made up of a thin layer of amnion. Within the amnion, we have embryonic mucoid connective tissue known as Wharton's jelly. Within the Wharton's jelly, we have three prominent blood vessels, paired umbilical arteries and one single umbilical vein. How do we differentiate between artery and vein? Of course, as I said, arteries form the eyes and vein forms the mouth. But you cannot tell this to your examiner, right? So how do we differentiate it histologically? Compare the thickness of the wall. The thickness of umbilical vein is less compared to the thickness of the umbilical arteries. This is how we differentiate between umbilical arteries and umbilical veins. Possibly then the question will come, what is the function of umbilical arteries and umbilical vein? Remember, these actions are exactly opposite to the actions of arteries and veins in an adult human being. For example, umbilical veins are responsible for carrying the oxygenated blood from the placenta to the fetus. Umbilical arteries carry deoxygenated blood from the fetus to the placenta, right? So this is against the thumb rule that arteries carry oxygenated blood and veins carry deoxygenated blood, right? Think of one more location in the body where this happens. Can you tell me? Yes, the region of pulmonary artery and pulmonary veins. Pulmonary arteries carry deoxygenated blood from the right ventricle to the lungs. From the lungs, the oxygenated blood comes to the left atrium through pulmonary veins, right? These are the two sites where this blood flow is reversed. This is regarding the functions of umbilical arteries and umbilical vein. The other question you will get in this slide is, which umbilical vein is left? We have two umbilical arteries, right and left, whereas we have only one umbilical vein. So which umbilical vein is left? So remember, left umbilical vein is left and the right umbilical vein disappears. This is how we remember which umbilical vein is found in the umbilical cord. Apart from all of this, sometimes you get macrophages within the mucoid connective tissue or Wharton's jelly. These are called as placental macrophages or Hofbauer cells. Apart from all this, if you take the section of umbilical cord in early development, especially when it is at the developmental stage of connecting stalk, we can actually see remnants of Allantois and Vitellointestinal duct within the umbilical cord. This is how you must describe the structure of umbilical cord. Remember, the moment you see a slide focused under dissection microscope, it is either spinal cord or umbilical cord. How do you identify umbilical cord? It has the features of a human face with two eyes represented by umbilical artery and a mouth represented by umbilical vein. This is how you must identify, different and describe the structure of the umbilical cord.